Welcome to Study Race. In this video, we will talk about tuberculosis, or TB, which is one of the top 10 causes of death worldwide. Every year, approximately 10 million people get infected with tuberculosis, and around 1.5 million die from the disease. Tuberculosis is the world's second largest cause of death from infectious disease after HIV. It is a contagious infection. It generally attacks the lungs of individuals. However, it can also spread to other parts of body, like brain and spine. As per World Health Organization, tuberculosis is caused by bacteria, Mycobacterium tuberculosis, that most often affect the lungs. Tuberculosis is curable and preventable. It has been described as king of diseases. It was discovered by Robert Koch in 1882. It is caused by different species of Mycobacterium, that are Mycobacterium tuberculosis, Mycobacterium africanosum and Mycobacterium bovis. Mycobacterium tuberculosis bacteria somewhat looks like this. It is a rod-shaped, non-spore-forming, aerobic bacterium. Tuberculosis progress in three major stages. First is exposure. The tuberculosis bacteria are spread through the air. When an infected person coughs or sneezes, the person does not have any symptoms and is not contagious. Second stage is latent phase, in which tuberculosis is present in body, but the individual doesn't show any symptoms. The immune system is enough to suppress the bacteria. Third is the active phase. In this phase, the individual shows symptoms of tuberculosis infection. The disease becomes contagious at this stage. Let's now look at how tuberculosis spreads. The bacteria spread through the air when an infected person coughs, sneezes, speaks, or sings, and someone else inhales the bacteria. Also, not everyone who inhales the tuberculosis bacteria will become infected with tuberculosis. Several other factors influence the risk of infection, including the duration of exposure, the number of bacteria in the air, and the immune system of the exposed person. It can spread through airborne transmission, close contact with an infected person, occupational exposure, or transmission from animals. The most effective way to prevent the transmission of tuberculosis is through early detection and treatment. People with active tuberculosis disease should be isolated and treated until they are no longer contagious. Good ventilation, proper use of face masks, and other infection control measures can also help prevent the spread of tuberculosis. It is mainly of two types: pulmonary tuberculosis and extrapulmonary tuberculosis. There are also some other types, that are miliary tuberculosis and tuberculous meningitis. Now let's look at how this disease progress in human body. At first, bacteria is inhaled. Now, due to immune response, bacteria is engulfed by macrophages. Formation of granulomas. The infected macrophages gather together with other immune cells to form granulomas, which are small, hardened nodules. The granulomas keep the bacteria contained, preventing them from spreading to other parts of the body. Phase of latent tuberculosis infection. Now this bacteria will become active when the immune system is compromised. Now, let's look at symptoms of this disease. Shortness of breath, hemoptysis, night sweats, weight loss, fever, cough, chest pain, fatigue are some of its symptoms. However, these symptoms can also be caused by other conditions, and the presence of one or more of these symptoms does not necessarily indicate tuberculosis. Let's have a look on how to identify tuberculosis. Mantoux test. This is a skin test that involves injecting a small amount of purified protein derivative, PPD, into the skin of the forearm. Chest X-ray. A chest X-ray can help identify changes in the lungs. Sputum culture. Nucleic acid amplification tests. Interferon gamma release assays. Blood tests. Biopsy and CT scan, and some other ways are there too. In non-pharmacological management, we can do the following: taking a balanced diet, adequate rest and sleep, regular physical exercise, infection control, psychosocial support, education and counseling, less crowded living conditions, BCG vaccination, avoid dust, avoid smoking. In pharmacological management, we can go straight to first-line drugs that are isoniazid in the drugs mentioned. If first-line drugs are not effective, we can move to second-line treatment, like levofloxacin. There are also some other effective drugs, that are streptomycin and others. Some physicians prefer combination therapy, due to multi-drug resistance. If other fail, surgery is the last option. Surgery may be necessary to remove infected tissue or to drain abscesses. In summary, tuberculosis is a potentially serious bacterial infection that mainly affects the lungs. It can be spread through the air when a person with the disease coughs or sneezes. Symptoms may include coughing, chest pain, weakness, fatigue, and fever. Treatment typically involves a combination of antibiotic medications taken for several months. It is important to complete the entire course of treatment to ensure the infection is fully eradicated.